I'm Dr. Jonathan Lee, Medical Director of the Aesthetic Studio. I've been practicing aesthetic medicine for the last 13 years. For the under eye, I think it's best to look at 2 or 3 things. The quality of the skin, like is there a lot of wrinkling, is the skin very thin, has it lost its elasticity? Also, we look at whether there's an actual eye bag. An actual eye bag is a bulge of fat underneath the eye. And we look for the third thing, which is there any hollowness underneath the eye bag, which is commonly known as a tear trough. These 3 components can be tackled with surgery in one single procedure divided into 3 parts, or it can be addressed with a combination of non-surgical techniques. And we have a lot of non-surgical options these days. We have options for tightening the skin, we have options for reducing the prominence of the eye bag, and we have options for creating a lift or filling in the hollows known as the tear trough. One very promising method that we use today in our practice is the micro-insulated radiofrequency needle. Without any incisions, we can now accurately place this micro-insulated radiofrequency needle into the fat pad, deliver very focused heat to shrink the fat and reduce the bulge. The procedure doesn't require any incisions, but there's still a small possibility of bruising and some swelling that may last 3 to 4 days and can easily be covered with camouflage. Some patients ask me if this is a temporary procedure. In fact, it is not. When we shrink back the eye bag, it stays that way. Naturally, aging progresses and the eye bag can recur over time as you age, but then a simple touch-up procedure is all that's required. Some patients have the impression that Botox is the cure for everything. If you've been assessed properly by a doctor to have the effects of excessive muscle movement around the eye, causing excessive wrinkles or pulling down the outer brow, making you look tired. So Botox is a very easy, very comfortable, and very affordable introductory procedure to someone just thinking about beginning rejuvenation treatments for the eye. Sometimes I get asked if Botox or fillers are better. Botox and fillers are in fact complementary. They do very different things. Sometimes we may use Botox if we're treating primarily for movement lines, or if we want to reposition some of the muscles, giving a more rejuvenated appearance in the upper face. And other times we may be emphasizing mostly fillers if we are trying to restore volume into areas where there's hollowness or there is descent.